I'm Julie Williams and I work in the Cardiopulmonary Rehab Department, and I'm a respiratory therapist. We have a cardiac side and then of course the pulmonary side. The cardiac side, a lot of times if people have had a heart attack or had stents, congestive heart failure, they would get us a referral. We would call them, get them scheduled. It is also a 36 session. Normally we try to get it done in 12 weeks. They come 3 days a week. Our sessions are about an hour long. We provide education, we have stress talks. Our dietitian will see the patient about once a month. And then our pulmonary side is for the breathing problems. We have 2 diagnoses that will qualify you for the pulmonary rehab, and that is COPD or post-COVID. And then we have an outpatient respiratory services if you don't quite qualify for COPD, but yet you're having breathing problems. You would come work out. We monitor your oxygen levels throughout and basically just try to get your breathing problems under control and help you breathe better. We teach you breathing exercises to help you when your anxiety builds and you start to have those breathing problems. It's kind of a scary deal having heart problems and then your first time back exercising and just seeing the confidence they end up getting. Most of them will say, that they really feel like it's helped them. They do feel like they can do a lot more than what they thought they could before, and the confidence they get. Yeah. We get a lot of our referrals from Joplin because the distance they need to drive to Joplin would be just, out of the question. So at least we're here closer to home for the patients in this area. I went to school at Weir and then to Southeast. I graduated from respiratory school in '96 and came to work here. I worked here for several years until I had my 5th child, and then I stayed home raising kids for a few years, and then I came back to work here in 2015 and been here since then. But I have been part of the Girard Medical Center family since I was 7 years old because my mom worked here for 36 years before she retired here as an RN. So I've always been a part of the Girard Hospital and feel like I was born and raised here. Their first day they do a 6-minute walk. Their last day they do a 6-minute walk, and we've only had one patient that didn't do better from the first to the last, and I don't think a lot of them realize how well they're doing until they do that last 6-minute walk and compare from their first day and realize, wow, I really have done something. I've always felt my roots were here. I like this community, and it's always been good to me here. It's a small hospital and I really enjoy it. I feel like most of the patients, with it being a small community, you either know them or know some of their family, and just the love you feel out of them, when you're out in the community, it's just loving. I'm Julie Williams and I'm rooted in rural.